And welcome back. Beauty has always been more than skin deep, and that is also true for men when it comes to confidence-building cosmetic procedures. Dr. Mark Craig has been practicing cosmetic surgery in Tupelo since 1997, and he showed us some of the different options men are choosing. In recent years, Dr. Mark Craig has seen more men coming into his office at Accent Plastic and Reconstructive Surgery.
We can't stop the aging process, but we can slow it down.
And the male patients span all age groups.
We'll see a younger group, I think people that are just trying to take care of themselves a little bit earlier.
Yeah.
And then we see people as they age a little bit, just trying to fight some aging, try to look better, be a little bit more competitive in the workplace.
Options for cosmetic procedures can be invasive or non-invasive. Dr. Craig allowed us to videotape a chest contour with the patient's permission. The Body Tight with liposuction procedure uses a radiofrequency device that melts the fat and also tightens the skin. The patient has few limitations during the quick recovery. The Body Tight device also minimizes bruising and bleeding.
That patient's usually just a couple of dissolvable stitches in their chest, or maybe a couple stitches that we take out within a week. We have them back to the regular activities in just a couple of days. As far as body work or working on their chest, so if they're going to go do like push-ups or bench press or go to the gym, we would just kind of keep their heart rate under 100 for the first week to 10 days, and after that we kind of get them moving along pretty progressively. You can come in here and feel this line here, just basically like a spackling.
Dr. Craig demonstrated non-invasive procedures on me. He gave me Botox injections on my forehead to help ease the frown lines and filler for those wrinkles around my mouth.
We're going to use an Allergan type product with would be Juvederm. We'll use Voluma for the cheek, Velour for the nasolabial fold, and a Volux for their jawline chin process.
The procedure for Botox and filler takes less than 15 minutes, and the results are rapid for the filler.
Big difference. Right. Big difference.
Within a couple of weeks, the effects of the Botox are evident. Dr. Craig says cosmetic procedures for men are less about vanity and more about confidence building.
We're changing people's lives, so we really look at, people talk a lot about plastic surgery as being a vanity issue, and what we look at it as is really a confidence issue. We make people feel more confident about themselves. We spend time talking to them, going over what their concerns are, and then trying to find the right procedure to match their needs. In some cases, that's going to be a non-invasive procedure. In some cases, that's going to be an invasive procedure, and we just have to make sure that we're on the same page, and really good communication like the rest of life. You just need to communicate, make sure we're on the same page so that we get the results that patients want and that they're realistic about what we can accomplish.
All right, and Dr. Craig is with us. Thank you so much for being with us.
Allie, you look great.
I know, right?
The new you is good.
Well, you did fantastic. You've been doing this for a long time, and I got a photo of my dad here. Because, you know, we all get different traits from our parents.
Correct.
And I don't know if they can get a close-up here of my dad, but you can see around his mouth there, the lines and stuff. So he was a handsome guy, wasn't he?
He was, and you can see as we talked with you in the office that he has a little bit of that deeper nasolabial fold area right outside the corner of the mouth. And it was one of the concerns that you had in the office that we talked about. That we added a little bit of filler in that case, you know,
yes,
when we were looking at your pictures of your forehead, really improving the lines.
A dramatic difference.
Softening, yes.
Right,
really.
Because you're not going to, like you said, you won't get rid of it completely, but you want to and you wouldn't want to get rid of it. I mean, that's part of, you know, people, that's part of who you are, but still you can slow things down a little bit.
Correct, and we see that a lot with people, so we've talked with you about different things. We had the discussions about the sun protection or sunscreen, things like that, things that people can do to minimize aging. We really look at trying to improve that, and then we're going to just try to do some reversal components for things. If we can do some preventive things on the front end, makes our job a little bit easier, but we can take people of all walks of life and all ages and do some correction and kind of turning back the clock for them.
Right. So what you're saying too is, especially younger folks watching and listening, take care of your skin now. right?
Correct.
Sunscreen, hats, that will help, down the road, won't it?
And that's what we talked about a little bit. We see a lot more men in the office now. You'll see a little bit of an aspect where people have been using some of the semaglutides where they have some weight loss, bariatric surgery, so we have some volume loss in our face. We talked about the body contouring procedure. So
we saw some of that.
Correct. And so those were good before and afters, pretty consistent what we see in our practice. And people are very comfortable with that. They feel more confident in their job and in their personal life.
Right. I was also looking on online. It said since the advent of Zoom and stuff, we do more video conferencing now. They say that's another reason that men are coming in for these procedures. They just want to look better.
They feel more confident, so they see themselves in the mirror. So if we're looking at the screen here and we're looking at ourselves, we want to make sure that we have a better jawline. They want to see that they look a little bit more youthful. They also want to see kind of that submental area. We talked about the neck area, just to kind of clean that up and clean up the jawline. So we see that with body contour. And so it's the same device that we used on that chest patient. We use that frequently in the office for men and women. Pretty simple to take care of.
And it all starts with a consultation. Come in and talk to a doctor.
So have the needs, have the concerns. We come in, we can talk with you, we can bring up your pictures and talk to you about it. It really makes a great function for people to be able to understand what we're trying to accomplish with them.
Great, and it's painless too. So my stuff was painless.
Good. Everybody differs on that, but for the most part, yes, sir. Yes, sir.
Thank you so much. It looks great, and we'll do some more procedures later on. All right, we have more Sunrise Saturday coming up after the break. Don't go anywhere.